Dr. Bart Hodgins, what does an adjustment actually do? Okay, so you are hurting. You might have tried stretching. You might have, put a hot pack on a sore spot, like if it's your neck or back, and you just can't seem to get better. You might have a friend say, hey, why don't you go see a chiropractor? You might have been referred from your MD. You might just have looked it up on Google, just like this, and you said, you know what, maybe I'm gonna try a chiropractor, but what does it actually even do? You might see other people's channels where you've got crazy devices with all these big pops and snaps, but what are the nuts and bolts of an adjustment? Okay, I'm gonna walk you through a couple small things, and hopefully this will resonate for the people who do need to seek an adjustment. Spine here, each one of these is a spinal bone, and we have cervical, thoracic, and lumbar. So depending on where you're hurting, let's just say it's your neck here, you might find you have loss of range of motion, it gets sore, you can't shake it with just stretching or a massage or anything. So what an adjustment does, well, first of all, what a chiropractor would look for is there a restriction in the joint. So if I'm using the neck for an example, and I have these two guys working as one unit instead of them working individually, that may set up a problem. And that problem, you just feel like, man, if I could just get it to move better, I would feel better. You may be feeling that. So what we want to do is restore the individual motion. So what your chiropractor will do is take you through different ranges of motion and obviously do a case history and try to find out where is this restricted. Do you need an X-ray? And we'll talk about that in just a second. Once they find this area, they might do whatever technique they're most proficient at to try to restore that normal motion. So, X-ray. Some people will force mandatory X-rays, others will not. I do not require X-rays, and here's why. X-rays are static. They're just a picture in time. They don't actually show any movement. They just show what a static loading alignment looks like. So, a rule of thumb is if it's not going to change your treatment, you probably don't need it. So in this case, if you have a routine injury, maybe you were gardening or a sports injury or a bike injury, you're moving pretty good, you're sore, but you just feel like something's just not right and you need an adjustment, usually we can get away with just range of motion, find the problem, and then correct the problem. So ultimately what an adjustment does is try to restore normal movement patterns to that joint. However you had the injury, whether it's long-standing from sitting in a chair, from exercise, or it could be an injury or even a car accident, the net goal is to restore movement. And to do that, the chiropractor will go down each segment, figure out which one has the problem, and then try to restore normal motion. Let's talk about now, you get adjusted. Wow, I feel great. Doc, you helped me. What should I do? This is the opportunity for you to help yourself the most. You don't need anyone for this. It's to start looking at an exercise program, especially around that injured area. If you're not sure what to do, I encourage you to ask your chiropractor. They may have a program for you you can do at home. You usually do not have to go in office for this, especially with getting range of motion back and getting stronger muscles. They might refer you to a physical therapist for a couple sessions. They might have you go to a gym and talk to a trainer. This all depends on what your health status is. If you've had surgeries, if it seems like a routine injury, it's going to be a lot more simple. But remember, adjustments just give you the opportunity to help your body help itself.